Hello and welcome to this Buttercups Bulletin. I'm Paul Johnson and I'm once again joined by Ellie Talbot, pharmacist and pre-reg tutor here at Buttercups Training. So we've been having a look at the feedback from the recent GPHC registration assessment, and we were kind of surprised to see that something was in that report that has been there before, suggesting that candidates sometimes have difficulty distinguishing between adverse drug reactions and allergic reactions with drugs, particularly with antibiotics. So what we thought we'd do is we'd give you a brief overview of the difference between allergic reactions and adverse drug reactions with antibiotics. What sort of things to be looking out for. Obviously lots more detail that you can get for the specific drugs, but we'll start by having a look at, in general for antibiotics, what sort of things you can experience as an allergic reaction. So, Ellie, what sort of things can we expect?
Well, your first one is what most people probably relate to an allergic reaction, which is a rash.
Yeah.
Now, this can be top to toe, or it could just be localised. So, for example, if a patient is using a cream, then it could just be in that particular area that they do get the rash, but
Right.
that can be a sign of an allergic reaction.
So rash is one of the first signs of an allergic reaction. Anything else?
Then you have cough, which is probably one that surprises some people, but actually you can get a bit of a cough if you're having an allergic reaction to a product, which then leads on to a possible wheeze, which then unfortunately can also lead on to having some throat swelling.
Right, well, throat swelling, that sounds a bit severe. Wouldn't that normally be a sign for referral?
Yes, basically if you've got anything where there's a throat swelling in there, that there's anything where they could potentially not be able to breathe, then obviously they do need to seek medical attention quite fast.
So assuming it was just a milder case, a mild allergic reaction to an antibiotic, what would you advise?
So if it's a mild allergic reaction, and that's an allergic reaction, then we would advise them to see their GP and also take a mild antihistamine.
Okay. So presumably seeing the GP because you don't want to carry on an antibiotic if you're having a reaction to it.
Yeah, so they do need to stop that antibiotic and then see the GP. So that's an allergic reaction.
Okay, so let's go back to the throat swelling then. So obviously we can get more severe allergic reactions and anaphylaxis. How would we be able to identify if that's happening and what would we need to do?
So your patient will be having breathing difficulties. So obviously, if they're not able to breathe, that's obviously a life-threatening situation. So they do need to, again, seek medical advice quickly.
Okay.
You can have swelling of the lips. They could become unconscious, unfortunately, lightheaded, confused, and then one of my favourite side effects, which is known as impending doom. Impending
doom. So the patient would have a sort of sense of fear or anxiety?
Pretty much.
Yeah. Okay.
A sense that something is really going to go wrong.
Okay.
And as they're having anaphylaxis, it is going wrong.
Right. Okay. So pretty obvious with that. If anybody's experiencing those kind of symptoms in response to an antibiotic, go to
They do need to be seeking.
A&E?
Yeah, pretty much 999.
Yeah, okay. Obviously, as you progress throughout the year, you'll be doing first aid training as a pre-reg. So you will be learning a little bit more about if you're faced with that situation, with an emergency anaphylaxis situation, what would you do? So we won't cover that here, but that's something which is mandatory as part of your pre-reg year as well.
Yeah, and remember to do a record of evidence of that.
Absolutely, yeah. You could get lots of evidence for that, I would think.
Exactly.
Okay. And then the next one then, so we talked about allergies, we talked about anaphylaxis. So what are the common adverse drug reactions that in general you can get with antibiotics?
So your most general one is your gastrointestinal. So that is your nausea, your diarrhea, your vomiting. They're just sort of like your general side effects that you tend to get with an antibiotic, and with most antibiotics, to be fair. Okay.
So say that I got a bit of tummy upset, a bit of diarrhea perhaps with an antibiotic. Is that always a sign for me to stop that antibiotic?
Not necessarily. So I say not necessarily because it depends on the antibiotic you're taking as well.
Yes.
But if it's just mild and it's not causing you any sort of too much harm, then what we would generally say is carry on with it, speak to your GP if it becomes a problem and have that discussion with them as to whether or not you should be stopping it or carrying on. But that's a generalisation, it's not for every antibiotic.
Right, okay, so obviously judge each individual on those particular circumstances. Okay, right. So there is a lot to learn about antibiotics. It is a very important part of the pre-reg year. It is a very important part of the registration assessment as well. So this is only a very brief overview to distinguish between adverse drug reactions and allergic reactions, but you will need to find out more and more details about specific antibiotics because they're common drugs. We see them every day in the pharmacy. So we are going to give you just a couple of examples of specific drugs, though, and the kind of problems that they can that can occur. But the one is perhaps more a general one, and that's candidiasis.
Yep. So you can unfortunately get oral thrush or vaginal thrush through taking sort of antibiotics. It has a side effect afterwards. It also gets rid of some of the good bacteria, so you end up getting a bit of thrush.
Okay.
Unfortunately.
All right. Another one to be aware of is quinolone. So things like ciprofloxacin. What's the one we really need to look out for that one, Ellie?
So that's tendinitis. So if you find that your patient is having any issues with the tendons, if they're having any tendon pain, anything like that, then we would advise them to stop their medication and go and see the GP as soon as possible.
Okay. Tetracyclines?
Tetracyclines is skin sensitisation.
Okay.
So basically it makes the skin very, very sensitive, especially to the sunlight.
Okay, so these are the kind of things that any patients that are coming in for prescriptions for them from the pharmacy, we need to be telling them about these symptoms to be aware of every single time. I always think it's quite strange with doxycycline, for example, that you can use that as a malaria treatment.
Yeah.
But doxycycline, if you're going to a really hot country, you're taking it every day for malaria, but your skin is very, very prone to burning and sensitisation. So
and
not
it's one
always
of the,
the best choice.
It's one of the cheapest, so most people look
Yeah.
for it, but obviously if they're going to a hot country, they need to be aware that actually it's going to make your skin very sensitive.
Yes.
So is it better maybe going for an alternative?
Exactly, okay. And then finally, clindamycin.
Yes, so when I was saying about the diarrhoea earlier, that's potentially one of the ones that you would have a look at, because with clindamycin, if you do get diarrhoea, that can actually be a sign that you have, unfortunately, C. difficile.
Okay, so any diarrhoea with clindamycin, always refer.
Yeah, well, you would get them
mild.
to stop and refer.
Stop and refer.
Yeah, because it can get antibiotic-related colitis, unfortunately,
Okay.
with clindamycin.
Excellent, thank you very much. So as we said before, lots and lots of information that you need to get on board during the pre-reg year about antibiotics. This is just a bit of a taster. For those Buttercups pre-regs, we'll be doing an infections workshop at some point during the year. So we'll be looking at very specific cases of antibiotics and the things as a pharmacist that you need to be aware of and advising the patient as well. So that's it for today. Obviously, if there's anything that you would like to see covered in a Buttercups Bulletin in the future, then let us know. But in the meantime, follow us on Facebook, follow us on Twitter, and also keep looking out for your next YouTube Buttercups Bulletin video.
Yeah, feel free to subscribe.
Thank you very much.
Thanks.
Thanks, bye-bye.